So pain is our subject today. It's a big subject, and I might just give a little bit of my background. I'm not actually a pain specialist. I'm an integrative general practitioner, but I do specialise in fatigue syndromes, and fibromyalgia is one of the areas I deal with, which has a lot to do with pain. That's muscle pain in particular. So I've done a little bit of postgraduate study on pain, physical pain, and we will today be also talking about emotional pain and the spiritual aspects of pain. So it's quite a broad talk. We better define what pain is to start with. This is the Oxford Webster's dictionary definition of pain. So they include in their definition physical pain as well as emotional pain. You'll notice there a symptom of physical hurt or disorder. The patient develops severe pain, and distension is an example of the use of the word pain. Emotional distress, a fundamental feeling that people try to avoid, the pain of loneliness. So we want to make it clear at the beginning that it is not just physical pain that people feel. This is the International Association for the Study of Pain's definition of pain, which is very similar. This is a more clinical, technical, medical definition of pain. An unpleasant sensory and emotional experience associated with actual potential tissue damage or described in terms of such damage. So that's quite a physical description. When I worked in a hospital in New Zealand, I thought I had a peptic ulcer. I had quite a serious pain in my upper left abdomen here, and I felt pretty convinced that as a result of the stress and strain of the system and being in the hospital, I had developed a peptic ulcer. I convinced myself. But I wasn't sure that that was the cause of the pain. But I went to a doctor at the hospital, a senior doctor who did gastroscopes. And I said, can you please put a pipe down and tell me if I have a peptic ulcer? I was even taking medication, self-medicating, thinking I had this peptic ulcer and giving my I was having side effects from the medication, feeling nauseated, which was not good, obviously. So I was in trouble, and unfortunately, he gave me a correct diagnosis. I say unfortunate. He said, "No, David, you don't have a peptic ulcer. It's just stress causing a bit of muscle tension and that kind of thing." But I was not convinced. Even though I trusted this doctor, I was not convinced. I thought, I'm pretty sure it must be a peptic ulcer. Anyway, when I left the hospital, finally I went to a GP and said, refer me for a gastroscope, and they did, and they put the gastroscope down, and the doctors, I was only under light sedation, and the doctor, he said the magic words. They were magic to me. He said, your stomach is pristine. And when he said that, I knew the cause of the pain is just muscle tension. And once I accepted that, the pain went away. I just thought, it's just muscle tension. Don't worry, just relax. So knowing the cause of the pain sometimes can bring relief. You stop worrying. It's nothing serious. And so diagnostic investigations can be therapeutic from the point of view of pain management. So if you are suffering from bad pain of unknown cause, that's a lot worse than knowing the precise cause. That's why it's very important.
And then all you need to do is just grate and into a soft paste, because the poultice needs to be nice and soft but still have some body into it. Okay? So what we're going to try and do here is show you a poultice here. Just what I'm going to do is poultice this leg. So you can use poultice at any part where you have a cut, bruise, into any section. But I chose the leg because the leg is the largest part that you will probably poultice, and you can find all these things at home. And so I just show you the leg, and then you can adapt to that later on. So what you need for the leg is probably a large, what I'm going to actually do is make this into a bandage. So I'll move the patient a little bit further. I'll probably best off to do this in the front so you can all see. I'll try and do it here. So what you do is just spread it out. Get yourself an old sheet, cotton sheet again, because it's going to hold the moisture, which we want to do. And to fold it in half. And what we're going to do is put some potato along half of that there and fold it over. So what we do now is just to fold that over, make it nice and flat. And then we just fold that up out like a normal bandage. You'll find that there'll be a lot of moisture in there. But what we'll do is just squeeze out that moisture. What I'm going to try to do is squeeze that moisture out into here, because we can actually apply that to another remedy, which I'll show you just in a minute. So you'll find that moisture. This we'll keep that. And then what you need to do then is to just bandage the leg. Important thing to do is when you fold that over, keep that on the bottom, because if you turn it up the other way, you know your potato is going to fall out, sort of thing. So so what I'll try and do is just bandage up this leg. And you'll find as soon as this person who had this leg there, as soon as she was in a lot of pain because of that cuts and there, and as soon as it's put on, she found that she had relief from the pain. And so it was the alkalining and the soothing effect of potatoes that does work very quickly. And so when the doctor was a little bit worried about her, so he sent his, a day later, he sent his young intern to see her, and he found that the very, very, very important that it was nice and clean. But in the meantime, we had actually put a steam tent and to bring more blood and circulation to there, and it was nice and clean. And he was so amazed that he went back and he says, you naturopaths can do what we doctors can't do. This is it's always stuck in my mind. And he said, you can draw the infection from the point where it is, and you can cure that. Whereas we got to wait till the infection gets into the body, give that medication, and to treat the whole body. So natural remedies can actually treat the pain and the toxins from its source.
If I don't cry, it means that I'm not sorry about the loss. This is kind of the opposite. There are some people who just don't, crying is not the way they deal with loss. That crying is not the way they deal with grief. I remember when my father-in-law died. He died suddenly of leukemia. We had about 1 week's notice before he got sick, and then a week later he was dead. And his mother actually happened to be staying with us at the time in Australia. He died in New Zealand, and she was over from England. We flew over, and the funeral occurred, but not once did she cry, and neither did his son, my brother-in-law. Neither of them cried at all at the funeral or at any time. And I cry at funerals. I do a lot of crying at funerals. I have to make sure I bring lots of tissues, and for me that's an important part. And so I was a bit puzzled. I thought it looks bad. It looks like they're not processing their grief, but actually they were processing their grief, but in a different way. So crying, I didn't understand then the individuality of grieving as well as I do in later years. So although crying is a normal response to grief, it is not the only one, and I may feel the pain just as deeply as those that cry, but just express my grief in a different way. So if you don't happen to be crying, it doesn't mean that you're not necessarily processing it.